Greetings everyone, and especially to all of you who are watching this video. Today's video is particularly be revolving around our discussion that was going around the COVID-19 pandemic. Yes, it is in addition to the COVID-19 pandemic, the current discussion will be pertaining about, and possibly the worst potential side effect that the entire COVID-19 pandemic side effects might entail. Yes, we'll be talking and referring about the very rare infection of the black fungus, which is commonly known as black fungus, but the actual name is the mucormycosis infection. It is the formation in human bodies during their post or during the COVID-19 infection. The mortality rate of mucormycosis or the black fungus formation is approximately 50%, and it is a potential side effect due to the steroids or the heavy medication that is being provided to severely ill COVID patients during their treatment of the COVID-19 infection. Hence, this black fungus happens it's created within the body of an individual, and it affects the sinuses, brain, and the lungs of the human body. Especially, it can be a typically life-threatening disease in especially diabetic cases, and also people with low immunities, which can be caused in cancer patients or people with HIV or AIDS. The rise of COVID-19 cases in India in the past 2 months have been exponential, and it's important to note of the rising cases of black fungus formation is directly proportional and related to it. The rise in these black fungus cases, making it a particularly fatal issue for humans, has made itself a niche as an epidemic itself, and our nation continues to face the shortage of treatments and medications for both the pandemic of COVID-19 and the subsequent issue of the black fungus, which has rose over a period of days and weeks in the latter month, and recently evolved as an epidemic of black fungus. It is important to know that the fair share of fungal cases have grown a lot and spread and evolved into a case of yellow and white fungus also, which is also assumed to be equally likely fatal or dangerous, or perhaps on a lighter note less fatal than the black fungus cases. Whereas it is determined that the change in color is due to the differential path and the time in which the fungus has evolved and grown in the body. Also, the first case of white fungus was noted in a hospital in Delhi, whereas it was noticed that the white fungus cases was spread across the intestine of the patient. And yes, it's proven that it's not yet proven whether the change in color is going to be more fatal for an individual or not. Yet it is a form of evolution in terms of the black fungus and has evolved into multiple colors. Rest assured, we all understand that this case of black fungus is fatal and has been growing. Yet the medications which are being taken into account for the treatment of these fungus are very scarce, and the government faces another issue to tackle and provide ample medications and treatment facilities for these fungal infections, which have been growing exponentially, perhaps in the people having post issues due to COVID-19 infection. Thank you.